Hello, I'd like to welcome you to Nursing Tutorials with Joel. In today's video, we'll be looking at drugs used to cure arrhythmias, also known as anti-arrhythmics. In a previous video, we learned about arrhythmias, also known as dysrhythmias, and we discovered that there are different types of arrhythmias. We talked about ventricular fibrillation, atrial flutter, atrial fibrillation also, and also ventricular tachycardias and other arrhythmias. So you can check out this video for more information about that. Alright, so today we'll be looking at a classification of antiarrhythmic drugs used in treating arrhythmias. In the year 1970, Vaughan Williams was able to come up with a strong classification of antiarrhythmics, and they are into 5 classifications. The first one deals with sodium channel blockers. These are drugs that reduce the influx of sodium ions into the heart, thus stabilizing the heart rate and stabilizing the beat, the rhythm of the heart. Example of these drugs include the following. We have quinidine, we have lidocaine, we have procainamide, disopyramide. Some of these drugs prolong or shorten action potentials. They are used in ventricular arrhythmias and in prevention of paroxysmal atrial fibrillation. Secondly, we have the beta blockers. In antihypertensives, we also have this classification, beta blockers. They block the beta adrenergic receptors and prevent stimulation of the heart. So, examples of these drugs include propranolol, timolol, atenolol. They together decrease sympathetic activity of the heart. Thirdly, we have potassium channel blockers. These drugs, they block the inflow of potassium ions into the heart. For example, we have amiodarone. Another example is sotalol. We have ibutylide. These drugs prolong repolarization, thus stabilizing the rhythm of the heart. Fourthly, we have calcium channel blockers. This, calcium has a stimulating effect on the heart. Therefore, these drugs reduce the flow of calcium into the heart and thereby reduce arrhythmias. Example of such drugs include verapamil, diltiazem. They also decrease conduction of impulses through the AV node, thus reducing contractility of the heart. Others include digoxin, the popular digoxin that is commonly known to have effect on heart rates. Digoxin reduces heart rates. At the same time, it increases the force of heartbeat, the contractility power of heartbeat. Therefore, nurses should be careful when administering digoxin, because digoxin shouldn't be administered to a patient who has a pulse rate of less than 60 beats per minute. Therefore, in administering digoxin, the first nursing consideration is to check the pulse rate. Another example is adenosine, and we also have magnesium sulfates. For now, these are the antiarrhythmics. These are their classifications, and this is what they're all about. So this brings us to the end of this video. For more videos, please subscribe to this channel. I'm here to teach and educate you on basic concepts in nursing. Thanks for listening. Do have a wonderful day.